Lippincott Advisor Application. Hello, my name is Sarah Curran. The purpose of this presentation is to provide information about the relevance and usefulness of the Lippincott Advisor application for healthcare professionals to use in their daily practice. Introduction. The Lippincott Advisor application is an application used by healthcare professionals to provide a medical reference. This application is available to both Android and Apple users. This includes iPads, iPhone, Android smartphones, and Android tablets. The application itself does not cost to download to your device. However, there is a subscription fee of $24.99 for a 12-month period to access this information. It is available 24/7, and the application does not need internet access. It will work offline with one exception. There's a section where one can access references and entries through OVID or PubMed. This is the only section of the application that requires internet access. Lippincott Advisor's main goals are to provide a reliable resource for healthcare professionals to use. This allows nurses to provide the best quality care and the safest care possible. Another goal they have is to allow healthcare professionals to access these resources 24/7. This application does not need internet access. Another goal they have is to provide the resources at the bedside. This is important because it involves patients in their care and allows for healthcare professionals to provide teaching and a better understanding to patients. Patients will gain a better understanding and will become more compliant if they do not have a knowledge deficit. It is important as nurses to use tools like this one to help with patient education. The application provides over 17,000 monographs and patient teaching handouts. Utility and relevance. This application offers many resources to healthcare professionals. It has over 3,000 evidence-based sources that address many areas of information for nurses at the bedside. This allows for efficient time management. It also reduces errors and helps provide a safe and quality care. The application has many components. These include diseases, treatment, patient education, signs and symptoms, diagnostic tests, associated diseases, and medications. Lippincott even provides MedFax medication patient handouts to provide to patients. All information within the app is evidence-based and are reliable. Usability. The application is easy to access. It is available 24/7 without Wi-Fi access. It is easily navigated and provides lists to make it easier for healthcare professionals to find what they are looking for. It allows for data entry. The application itself has an easy-to-follow layout and is well organized and efficient. It makes it easy for healthcare providers to integrate this source into their workflow. It also provides immediate answers to many subjects to eliminate time wasting while providing accurate and reliable resources. There are two ways to access immediate information while using this application. The application is organized into lists. The diseases are organized in an alphabetical order to make it easier to find information one is looking for. The second option is to enter items into the search bar to help nurses find more specific information. Legal and ethical. The application maintains updates to make sure information stays up to date based on evidence-based practices. The drugs are updated weekly, diseases and treatments are updated annually, signs and symptoms and diagnostic tests are updated every 3 years. If information needs to be updated and it is critical, information will be updated at this time. The application also has a privacy policy. It states that it will not take personal information from anyone who is under the age of 13. The privacy policy is provided for users to know how and when their private information will be used. This application also states that the information provided from the application should be used as a supplement use only, and not as a substitute. In other words, nurses should know this information before they use the app only as a substitute for knowledge they should have already known. Analysis. The Lippincott Advisor application provides many benefits. It has over 3,000 evidence-based entries which covers diagnostic tests, diseases, treatments, signs and symptoms, drugs, patient education, and handouts. They also provide nursing care plans, references, images, guidelines, and much more. The application is essentially a point-of-care visual library for healthcare professionals to use. It is available at the bedside, which saves a lot of time. The application is well organized and allows to search the search bar to quickly find the information needed. The limitations include having to pay for a subscription and taking note that guidelines may be a little different between hospitals. I would highly recommend this application to all healthcare providers because it is easily navigated, provides safe, reliable, evidence-based sources to use. It is also a resource we can use at the bedside to involve the patients in their care. The application also offers a dosage calculator not only for adults but also for pediatrics. Conclusion. Lippincott Advisor application is a very useful tool for nurses to use on a daily basis. It is reliable and easy to access at the bedside and allows patients to be involved in their care.